magic. Here we go. Here we are.
There it is. Now we can see it. All right, Kate, are you, I can see you in the back of your head in the corner. We're behind you, our camera, but there we go. There we go. Okay, looking around the room there, do you feel like we have a quorum? I can kick us off.
Yes, it looks like
I guess I should ask, can you guys hear my audio okay there in person?
And yes, we can hear you well. Thank you.
Okay, excellent. Okay, well, we can go ahead and get started. Welcome, everyone. I am traveling back home with my dad had surgery, so I'm zooming in and appreciate your flexibility as I'm virtual instead of in the room. But thank you for Commissioner Farr willing to take over chairing if this gets complicated. We have a pretty packed agenda, so we're going to try as hard as we can to stick to the timing here, but have some really good updates for you all on a few things that folks have been asking about. The Navigation Center being one of them. We had some requests on kind of where things were at with that piece of it. And then some administrative pieces based on our role as the continuum of care, system applications, community action, assessment update, et cetera. So had a packed agenda. Before we get started, Kate, we have member check-in and quick updates. I don't know if there was anything specific you were hoping folks to chime in on.
No, just to recognize those who are here in person and the challenges with parking and construction, and just thank you for working through that to be here in the room.
Excellent. Is there anyone here for public comment, either on Zoom or in person?
I don't have anyone in person.
Okay. I'm not seeing anybody. I don't see any hands raised on Zoom or anyone in the chat either. So, okay. We don't see anybody. We'll move on. We need to approve the previous minutes from last month's meeting and the consent agenda. So you guys should have seen that in your packet that came out earlier this week. There's a motion we can get on the table.
I move to approve the minutes.
Second.
Thanks, Mayor. And then we got a second. Excellent. Are there any discussion items, questions, things you want to call out? Okay, hearing none. All those in favor of approving consent agenda and the previous minutes?
Chair Quick Warner,
raise your hand.
Message from staff prior to the vote. No, go ahead.
Yeah, go for it.
Can you hear us now?
Uh-oh, we just lost audio online.
A signal from Metro. Can you hear the live mics in Harris Hall?
Yeah, we can hear it now.
Excellent.
Sorry, Commissioner Farr, did you have a comment you wanted to make on the consent agenda?
Negative. I was just, staff had a hand raised. I just wanted to make sure that they, whatever they needed to interject, they could. So, thank you. Thank you, Chair.
Excellent. Okay, all those in favor? If you're online, raise your hand or put up your virtual hand raise if you're in the room. Kate, hopefully you can take a note. Any opposed? Okay, by my count, that passes. All right, so first up on our agenda item, we are going to hear from Brianna, who's going to talk a little about tenant selection policy, and we're going to take a vote on that policy that was presented last month.
Madam Chair, could I jump in for a moment here? I have a quick question for Kate. Our agency provides home tenant-based assistance. We actually do not receive any funding to actually do that, but do I have a conflict of interest on this item?
Just to be safe, I would declare one,
Then
yes.
I will declare a conflict and recuse myself on this item.
Thank you.
Thank you.
Thank you. So in your packet, and thank you for that, Mike, in your packet is a home tenant-based rent assistance tenant selection policy. Let me back up for a second. My name is Brianna Rogers. I'm a program services coordinator with Lane County, and I oversee anti-poverty and homelessness prevention programs. And I'm here today to review the policy and hopefully get an approved vote from the board. So in your packet is the tenant selection policy, home TBA, for home TBA, and we've created this for the 2023-2025 biennium, and we're hoping to formalize this process via this board. So home TBA is a subsidy program and case management-based program run by two rural providers, one being Community Sharing Program, and then the other being Cellular Outreach Services in Florence. And eligible households can receive either 1 or 2 years of subsidized rent in order to stabilize their home. During this vote, it's to adopt the updated plan, and this plan overviews the program, the eligibility criteria, the application process, the waitlist process, fair housing and affirmative marketing. And the only updates to the policy that we've made since the last biennium are two things. One is that we clarified that we are prioritizing applicants for this program based on those who are deemed in highest need based on our community needs assessment. So if there are any changes within the community needs assessment that says that certain populations are most at risk of becoming unhoused or in the most need, we will update our home TBA tenant selection policy based on the community needs assessment. The other update is that we are now using Cognito applications, so an online form to receive all of the applications and process the applications, and that just helps with efficiency and making sure we've got all of the documents in one place and a clear way to approve those applications. So looking for a vote on approving this process today. Or any questions, sorry.
Chair, would you like me to manage the queue for you on that, on questions?
Yeah, that'd be fantastic. Thanks.
Thank you. And Brittany, I see no questions. Any questions online? I see none.
Okay.
Do we have a motion? Are you
Yes, I'm looking. Oh,
I'm happy to approve the, this tenant selection policy.
thank you.
I need a second, though.
I'll second.
moved by Mayor Venus and seconded by Donna Butera, Chair Wickwarner?
Excellent. Thank you.
Thank you.
Any further discussion? All right, all those in favor of approving this selection process, indicate by raising your hand. Thumbs up. All right, anyone opposed? Any abstentions?
Abstain.
Thanks. All right, looks like that passes. Thank you.
Thank you.
And for the record, with the Councillor Fleck recused. Thank you.
Excellent. All right, we'll toss it over to you, Kate, to talk about the continuum of care application.
Thank you. So as this board knows, nearly every year HUD releases a consolidated continuum of care application. And this application is overseen by the Continuum of Care Board, which is the Poverty and Homelessness Board. And for me, it is incredible insight into what I often refer to as the brain of HUD, that it helps us understand, where is the U.S. Department of Housing and Urban Development really pushing communities to move toward in their efforts to reduce the number of people who are experiencing experiencing houselessness. You may be familiar with the updated strategic plan that was adopted at the federal level by a consortium of interagency groups, the United States Interagency Coalition for Homelessness specifically, and that strategic plan has led us to the application that we are working with today. The application is due on September 28th. And I will give props to HUD for giving us nearly 3 months to work on it. Last year, you may recall, we had less than 2, and that was really challenging. And so I do have a PowerPoint when you're ready to put that up. So the local Lane County funding amount that we could receive is up to $5.7 million. And if this seems like an increase from last year, it is, particularly because the Youth Homelessness Demonstration Program dollars that we received this year has been added to the overall award amount for the continuum of care. And so that's exciting. It consolidates, all of our HUD-related funding. And the other exciting part, and more props to HUD for this, is that the youth homelessness demonstration programs do not need to compete as a part of the continuum of care process for another 3 years. And so they're part of the application. We have to submit the projects, but we don't have to have our YHGP programs compete against the continuum of care programs for another 3 years, which is great. It just means we know they will move forward for a 3-year period. The primary role of this board is to make sure that the continuum of care application gets submitted, and that is done in 3 parts. One being a consolidated application, which is answering hundreds of questions about our overall system that supports people who are houseless here in Lane County. And it encompasses all programs, regardless of jurisdiction or funding. We also need to submit the project application. So the McKenzie Rapid Rehousing Project, Sahaley and Camas through Shelter Care, all of those projects need to be submitted on an annual basis to HUD. And then our role is to rank all of our continuum of care projects based on a local evaluation process. And so thanks to those of you who have been a part of the continuum of care program evaluation process, that ranking of those existing programs has occurred, and I'll share the results of that in a few minutes. The ultimate kind of reality of the application is for each of the questions that we answer and for following the HUD identified rating and ranking process, we get scores. And the higher the score on this full process, the more money it equates to for the community. That is also dependent on the overall pot of dollars that HUD has allocated for this upcoming fiscal year. But our goal is to answer the questions, to the best of our ability based on what HUD is looking for and our reality here in Lane County. Next slide. So there are a number of focus areas that HUD has identified for the continuum of care, and these are the key, like what is HUD thinking for this upcoming year? And their focus areas have not changed considerably in the last few years, and do align well with the work that we have been doing for the last few years since I've been in the community. They include ultimately reducing the number of people who are houseless in the community, using a housing first approach, working to improve the different system measurements that HUD has identified, such as exiting people to positive permanent housing destinations, increasing partnerships across intersectional systems of care, increasing racial equity, making sure that those who are being served among the programs for people who are houseless is equal to or even greater than the overall number of people within certain racial or ethnic demographics. Continuing to engage people with lived experience of houselessness across all the work that we do. And then also a newer focus in the last few years around increasing affordable housing supply. And that also is a key component of reducing houselessness in communities. With this application, there's a few brand new components that are positive in my book. They include increasing the planning allocation from 3% of the overall award to 5%. And that is an allocation that Lane County receives for all the continuum of care coordination work that Lane County does. I mentioned the YHGP grants are now a part of the overall award. And HUD has also provided flexibility to be able to move dollars within agreements across line items up to 10%. And that's great because that just reduces the overall amount of paperwork that is having to happen. And then there's also been an update related to the definition of homelessness. And this update has just increased the opportunity for someone who is doubled up or couch surfing to be able to be defined as houselessness. And I will share that very specific definition and provide additional details as we're still waiting for that rulemaking to come out. But it's positive. I think that HUD is very much recognizing the kind of national interest in being able to include more populations that are at great risk. And I'm looking at Donna because we know that our McKinney-Vento liaisons have been pushing for a long time for this. Next slide. So I mentioned that program evaluation for the continuum of care projects has occurred. And that included our project agencies submitting data and narrative regarding their projects. An evaluation scoring group came together and scored those projects based on objective criterion. And then the scores were shared with the programs. They had an opportunity to appeal if they had concerns. And at this point, the scores stand for those programs. A few pieces of feedback that evaluation scoring committee shared that I think is important for us to note include that the continuum of care projects do need additional support related to progressing equity and inclusion. Providing client-focused supports, providing trauma-informed supports within their programs, and then increasing progress toward the identified outcomes that each of the programs have. They, too, work towards system performance measurements, which include positive exits, as well as increasing income for the members of their programs. And it was identified that the agencies could use additional support, and often that's provided through training and technical assistance.
We have a question from Mayor Vinnes.
I just want a clarification when you said, and you sort of answered it, what that meant by need to seek, like who is suggesting they need to seek it, but it is HUD in rating them, or is, yeah.
No, thank you. I appreciate the opportunity to clarify. So it's the evaluation scoring group, which was members of the continuum of care. So this group who scored. In fact, was anyone who's here part of that evaluation group? Great to see Debbie's hand.
Yeah.
Thank you. And so that group in their scoring process, thank you, Catherine, had suggested that these are training and technical assistance opportunities that the agencies could use to improve their scores. Next slide. So what you have here are the final scores of all the continuum of care programs. And so you can see that Laurel Hill, for example, in their NEL program, which is a newer program, scored the highest. And Shelter Care and their CAMUS program scored the lowest. There are kind of the two blue programs and then the 4 pink programs. Those are all one project in HUD's eyes that Lane County coordinates. And so that's why you see the combined percentage score on the far right is just an average of those scores within those programs. So just thanks to the continuum of care projects and agencies, this is a lot of work to be done on an annual basis, but it is also a great opportunity to reflect on what opportunities for improvement exist, and also recognize that this represents COVID times, and we know that that adds a whole nother layer of challenge for any housing program. Mayor?
Sorry, you may have said this and I may just have missed it. So, and I did go through this once, but I don't remember on the final score. So if Laurel Hill's getting 86% and Shelter Care is getting 51%, what are is there a direct correlation between those scores and the 4 areas that the evaluators said they needed more support in? Is that fair to say that that's a direct correlation? Some need more than others?
I think so. Certainly if those who were part of the evaluation committee would like to comment, feel free. The process heavily weighs on the outcomes that the projects are to achieve. And those points of improvement are also very clearly connected to the outcomes. And so I think that your point is accurate.
Okay. And in the categories, there are a number of different agencies that are all getting what we're calling McKenzie. That's a McKenzie program. So is that you would define it later. Rapid rehousing. Is that a rapid rehousing program that they're all using the same source of funding for?
Correct. Yep. All right, let's go to the next slide. So part of our role is to rank the projects, and I want to preface this by saying I'm sharing this now, not because I'm looking for a vote or any decision, but because I think it's complicated. And so I wanted to share it ahead of any vote or decision so that you have time to ruminate on what's being shared and ask any questions before a future meeting where a vote would be held. And so the ranking process is done in 2 tiers. There's one tier where approximately 80% of the total award for the continuum of care programs, so this is not including the YHDP programs, that those programs are ranked, and if a project is in tier 1, then they are basically guaranteed to be funded through the COC process. If a project is in tier 2, and this is often about 20% of the total continuum of care award, then the funding is based on the overall continuum of care application score. And so it means that the project is at risk and that the project that is closest to the tier 1 has a better chance of being funded than the second project down or the third project down, because HUD just keeps going in a big circle among all the applications. And so it means that as a continuum, there's a strategy that we want to think about when we're placing programs between Tier 1 and Tier 2. We do know that the messaging from HUD is that they like new programs, they like to fund new programs, and that they also like it when continuums of care choose to end programs if they're not consistently performing well. And that term, kind of consistently performing well, is up to each continuum of care. You know, for us, it could mean that a program doesn't perform well for 10 years. For other communities, you know, it's just simply 1 year. And so that's opportunity for us to continue to think through. And the evaluation committee will also come with a proposal, having thought through a number of these strategies to the next meeting. Next slide. So, having shared this idea of a Tier 1 and Tier 2, where in Tier 1, programs will be funded, in Tier 2, they may not be, but we are always hopeful. There's a number of scenarios that we've put forth in previous years that help us strategize. And there are 5 of them that we looked at last year, which have different approaches. The first 3 scenarios look at placing the existing continuum of care programs at the top, and then the new bonus programs, which the continuum of care application has offered again this year, and include a general permanent supported housing, a bonus, or a domestic violence bonus, or both, could be placed toward the bottom in Tier 2. Or in scenario 4 and 5, we could put those bonus projects, the new projects, up at the top, and then put the projects underneath those, which means more of our existing projects would be at risk. And so in your packet, there are Excel spreadsheets that kind of illustrate this a little bit more. And I wanted to introduce it just simply so that you could start to think about it. And please don't hesitate if you want to sit down and chat with myself, or Amanda Borda is back after parental leave, which is wonderful. And she too can talk about this. But these are options that the scoring committee will ruminate on in the next month, and they will bring their recommendation to us. But I also want you to have an opportunity to think through it as well. Next slide. So I mentioned that there are 2 new program opportunities through this application. One being the continuum of care bonus, the second being a domestic violence bonus, which encompasses people who are survivors of domestic violence, sexual assault, or stalking. And HUD is looking to invest in these types of projects to enhance the supports that are being provided to communities. And so Lane County has put out a request for proposal that has opened and now closed. And we did receive proposals for the continuum of care bonus. So that's exciting. That likely through the process, we will have a continuum of care bonus to move forward with. Through that request for proposal process, Lane County did not receive a domestic violence bonus project application. And so what that says to us at Lane County is that unfortunately there isn't an agency in the community that identifies as supporting these populations, folks surviving DV, sexual assault, and stalking, that's interested in engaging in the continuum of care process and potentially getting funded. Continuum of care funding is challenging. So it's understandable that we have phenomenal, DV agencies, but they may not be interested in these dollars. And so next slide. So last year we had a similar circumstance, and the Poverty and Homelessness Board decided to allow for Lane County to put in a proposal to enhance coordinated entry related to the focus areas. And so Lane County, again, would be interested in submitting a proposal to enhance coordinated entry. The DV bonus is going to be approximately $105,000. And it would really focus on training and technical assistance to improve the experience of survivors working with coordinated entry, and also help enhance the warm referrals being made to survivor-focused agencies when someone is identified. And so again, we're not at a point where we're looking for a vote, but just wanted to share with you that this ask will be coming from Lane County. So I recognize that's a lot. And again, please feel free to reach out if we can sit down and have a more in-depth conversation. Myself and Amanda are pleased to be able to do that. Mayor?
And we will have a conversation. I'm just thinking about your 5 different strategies for prioritizing. We'll have a conversation focused on that, or will that review committee be doing that?
So the review committee is going to be identifying what strategy they recommend that the Poverty and Homelessness Board move forward with.
Right. I would just, I guess, plant the seed of 2 of my thoughts around that, which is that I understand the desire to have successful metrics for existing programs, before putting more money in, but I'm also recognizing that some of those programs that are struggling are working with pretty challenging populations, and what I always hope for nonprofits is that there's some stable landscape for them in terms of funding. So, unless there's a really strong reason to move an ongoing program lower down on the list in order for bonus points, unless there's a really strong reason, I would just encourage the committee to really think about retaining those. And it's not clear to me, I remember having this question last year around are there things that program really could do that it would improve their metrics, or is some of that difficulty just built in? Sometimes you serve a population, they're hard to stabilize, but it doesn't mean that the service is not valuable. So I'm just wanting us to be thoughtful about where we're applying those sort of very objective metrics and maybe undermining sort of important local work. So just my 2 cents on that.
It looks like there's a couple folks on Zoom too that have questions. Sorry to cut you off, Commissioner Farr.
I'll just be in the queue, Chair.
Okay, excellent. I think I saw Corey. Councilor Radley.
Hello. And I know you all are going to have a more in-depth conversation, but since I am the super sub for Mayor Van Gordon today, I might not be here for that conversation. So just a couple of things I wanted to poke at. And I appreciate Mayor Mena's wanting us to dig in more to what are the populations being served, because I think that's real and that's fair. And listening to Kate talk about the priorities that HUD has in terms of wanting to support kind of emerging and new projects and organizations, which I think we also have as a continuum of care and at the HSC and all these levels have wanted to do. One of my concerns, and I beat this drum before and will continue to, is looking at, okay, if we're going to fund these emerging organizations, how do we support them so that they can meet these hard requirements and the reporting requirements for multiple reasons? One, I want them to do well and succeed, and I want us to continue to have access to funding and not mess things up. So it's I know we've talked about it at various levels in various ways, and this might be an opportunity, whoever is moving forward to this, to in the criteria to be okay, we've said we want them to do better in these areas. What are the But how do we do that? Do we have some sort of central services that we are helping to fund that includes, financial management or equity planning or whatever it is? Like, how do we support that so that we're not just continually kicking the can down the road and not necessarily growing the capacity of those nonprofit partners? So it's just something for you all to think about, because it hit me when Kate said that there were this $105,000 or $110,000, and we do, like with Hope and Safety Alliance, have some great organizations, but if they don't want to touch the funding, there's reasons, and what do we need to do to help to alleviate that? Thanks.
Yeah, thanks, Counselor. Commissioner Farr, I think you popped in just before Chris.
Go ahead with Chris, and I'll follow up last. Thanks.
Chris?
You say Commissioner Farr, then me?
I think he's going to follow you.
You first, Vice Chair, then me.
Thank you, everybody. This is very important work, and as someone who's been on the ranking committee for several years, last year was the first year I did not participate since my joining this body. DV has taken kind of a back seat, and so whereas I support this proposal idea as a provider in our community, I get a lot of referrals from people who've been turned down or there's not enough vouchers, et cetera, for people with DV. We've taken DV, and some people have asked that we put them in a preferential treatment because of the lack of services in this community. Do we know if this proposal would provide a pathway for those who are participating in the current shelter system to actually have resources or places to be for those DV folks, or is this just holding space for the county to better coordinate, but not necessarily having the outcome?
So I think it's important to keep in mind this is $105,000. So unfortunately, it's not a large amount of money. I think that on some level, Chris, your suggestion of kind of holding space will be the first focus, and then also, can we create more defined paths for survivors in order to connect with appropriate agencies to help meet their needs? And the other thing that I think is sorely needed is safety planning and training around safety planning for anyone that is fleeing or seeking to flee a challenging situation.
Thank you.
Commissioner Farr?
I'll be very brief. Thank you, Chair. Mayor Vinish, you said you wanted to put 2 cents within on this. I fully agree with what you said, bearing in mind that some of our nonprofits are vastly under-resourced. And even in their under-resourced or understaffed, they can't even fill their existing staff positions. So making certain that we're taking that into account whenever we possibly can, even with small amounts of money, but making sure that the under-resourced nonprofits aren't overlooked or aren't graded down because of it. So to your 2 cents worth, I'll add 3 cents and make it a full nickel. How's that sound?
Looks like Bob.
Yes, thank you, Chair. Let me lower my hand here. Just kind of wanted to make a couple comments in response to some other comments that have been made. So the domestic violence side, that's part of what we do. And just to make sure that everyone is aware, there are a lot of resources, both through our agency and Hope and Safety Alliance, can provide that technical assistance in terms of safety planning and recognizing what is DV and what is not DV, because that gets thrown around a lot to try and secure housing. Because there are people that know that that's a priority, and so there are a lot of resources. Plus, there's the Oregon Coalition Against Domestic and Sexual Violence, which has a lot of resources for technical assistance. So as you develop those pathways or try to navigate that, just want to make sure that you're aware of those resources. As to what those agencies need, challenge that I know my colleague Mike Fleck and I we've talked about the challenges of every time there's a new program that's created, that means more staff, and oftentimes that staff is simply to just do paperwork and not doesn't really affect change. The change really happens from those staff building relationships with the clientele. And as we see these, programs popping up, and it's always a new program. It's not about sustaining existing programs. It's about creating something new and for lack of a better term, sexy because of buzzwords that are out there. But oftentimes it just comes with so much paperwork that we have to hire staff just to do paperwork, not to work with more clients and not to increase our capacity. So that's something I would hope that is considered as, you're talking about appropriating funds, that you're aware of those challenges of those agencies.
Thanks, Bob. I don't see if there's other folks in the room. Otherwise, Kate, I'll let you make the call on moving on. I know we're a little bit behind on the agenda.
I will go ahead and move on. And again, happy to talk further about these pieces. I think for myself, just want to make sure that folks, learn more about the continuum of care process this year than they may have learned last year. And so really happy to share more information and have further discussion. So the next thing that I'd like to give you an update on is related to the Human Services Commission and the Poverty Homelessness Board reimagining. And we have been working through this process since the end of last year, and have really done some considerable outreach and gotten some really valuable and informative information. And so just looking at the timeline, you can go to the next slide. We started having conversations with key stakeholders between our consultants, Uncommon Solutions, and those stakeholders. And then in April of 2023 through May, the consultants help us identify potential structural changes that the two bodies could consider, which included, actual structural changes, as well as the potential of, keeping the structures the same, but really digging in deeply between the charters and the bylaws that exist today. In March of 2023, the interview results were shared, and then the chairs of the HSC and the PHB came together to help just kind of give a stamp of approval regarding a decision-making framework, and then a survey that we sent out to this body and the Human Services Commission to have a better understanding of, among the different options that were offered, as to what the structural makeup of the PHB and the HSC could look like. What is your feedback? And the results of that survey were sent out to the Poverty and Homelessness Board members in preparation of this meeting. And what we saw is that there was great interest through that survey, and kind of also backed up by the stakeholder interviews to either look at kind of, again, holding the same structure for those two bodies, or moving the community action piece of the Poverty and Homelessness Board over to the Human Services Commission. And so we took that feedback and continued to have conversations. We've had great conversations with City of Springfield staff, as well as City of Eugene staff, and some other key stakeholders, just to continue to get a pulse on, what feels best, particularly related to the overall goals that we have with those two commissions. And so what continues to pop up is that the structure we have is strong, and that having the Poverty and Homelessness Board oversee the community action and the continuum of care is working, and there's absolutely opportunities to dig into the bylaws and add increased clarification, as well as memorialize the intentions and the goals and the values of the group. And so wanted to share that, and I'll go a little more deeply in other slides. But what we're doing now is sharing kind of where we are today. And Kachina Inman, our Assistant Director of Health and Human Services, has been instrumental in this process, working with myself and other county staff. And then once we, get a pulse as to, how does it feel if we keep walking forward with the same structure? We're going to bring this feedback to the co-chairs of the HSC and the PHB, and they will make kind of a final recommendation as to what structural changes, if any, ought to occur. And then the commissioners, the Lane County Board of County Commissioners, will receive a presentation regarding the final intent of this process. So we continue, and let's go to the next slide. Next slide. And so again, these were the possible structures that were shared, and B and C were the ones that the survey and the chairs really ruminated upon. And then it's C that as continued conversations happen, we continue to hear, I don't know that we need to rearrange things as greatly as we may have originally thought. Next slide. So as we continue to analyze the structures, there are absolutely kind of key needs that are rising that would need to occur should the structures remain the same. And it would be identifying the values for each of those groups and making sure that there are clear decision-making criteria that are baked within the bylaws of the group or the charter. Making sure that there's clear goals and roles. I would say for the PHB that we have a start with all of those things that exist today, but that there's further clarification that we can bring. And then also to define and strengthen the relationship between the HSC and the PHB. I've been in my role for about 1.5 years, and it is still unclear to me. And so that process of identifying the relationship is also going to be a key component that we need to move forward with. Assessing and redefining member composition. As we fill out the continuum of care application, for example, there's a very long menu of representatives that we need to literally check a box of, do we have someone that represents the LGBTQ plus community? Do we have someone that has lived experience of LGBTQ plus? And so we don't necessarily kind of meet all those requirements. And so do we have an opportunity to expand the membership? And the board, making sure that we continue with the tripartite requirement from the continuum of care. And then lastly, just recognizing that we don't do our work in a bubble and that there's enormous intersectionality between behavioral health work, physical health work, criminal justice, et cetera, and that we have an opportunity to memorialize how we work intersectionally with these different systems of care. So, those are great, very helpful points to help guide next steps if we move forward with keeping the same structures. Next slide. Digging a little further, there were some key needs related to each of the groups. With the Human Services Commission, there were ideas around, focusing more heavily on policy advocacy, potentially bringing in additional Human Services Commission dollars, whether it be inviting additional jurisdictions or even, private entities like a hospital system, et cetera. Defining the role of the Human Services Commission is one that we hear often. And then looking at the membership of this group, and I know there's high interest in further defining the role of staff among the electeds from specific jurisdictions. Next slide. So also some more specific needs related to our board. include a solid strategic plan, and I think this is something that we can definitely find agreement on. We are still working on a kind of time-limited, shorter strategic plan right now, but there is great opportunity for a 3 to 5 year plan to help guide our work. I mentioned increasing membership. We do have an opportunity to increase our anti-poverty work to further clarify the scope of the PHB, and then also to memorialize the scope of the board's decision-making and kind of what might we be making decisions around, and then what might be a place where another board would make a decision around, HSC or otherwise. And so I wanted to share this feedback with you because I think it's valuable food for thought and a result of a pretty extensive process thus far, and give this board an opportunity to react to it and to be able to provide feedback. Please know we often don't have ample time in this board for everyone to give feedback, and so if you don't have a chance, again, feel free to reach out to myself. Kachina Inman as well is very involved, and we're happy to talk with you further.
Kate? I'll just add, since my name is on the agenda item, my Nicholsworth. On one of the slides, further analysis of structure, it says define and strengthen the relationship between HSC and PHB. And historically, there's been a little bit of a divide there, and I'll state this. I was on the HSC since 1995, and until this year, I've been on it continually during every year of my elective service. I was also on the PHB from its inception until today. So for a large period of time, for 7 years, I was HSC and PHB. I was the only member of both. Now, we had staff that attended both meetings throughout those years, but really there was little opportunity for the two boards to really merge their work, other than what I believe was a very complete, workable, and effective strategic plan that the Poverty and Homelessness Board had from its inception until approximately COVID. I'm not going to blame COVID by any stretch of the imagination, but that really was kind of the death knell to that particular strategic plan, because we couldn't continue with the tactics that were listed under the plan. Some of them went along because they had a life of their own, but the board itself wasn't really able to, on a regular basis, work the plan. So that leaves us, in my estimation, where we are today. Now, me being a member since 1995 and since the inception is not necessarily a strength. In fact, for me personally, that could be a weakness, because that could have given me a tunnel vision that nobody else has regarding the way the two boards have worked together. But I believe that taking a look, as Kate has stated, at the charter of the two bodies, and making sure that there is an overlap and a merger and a full understanding as to how the two can work in conjunction, both separately and together, to make a really doubly effective body of work that we can accomplish. I believe that we have that in the future, and I'm looking forward to the further deliberation of this entire board and the Human Services Commission, which I no longer serve on. So, Chair, back to you for the cue.
Thanks. I'm not seeing anybody online. I don't know if there's folks there in person.
If nobody else, I'll jump in.
Mayor Vinnis.
So I just really appreciate how hard this is, because I think, I think there are a couple of challenges for me, and I can't figure out between these two most favored options, A and B. I cannot see from this discussion how this would change or benefit the dynamic that the city of Eugene experiences, right, in terms of the uncertainty of our role. Like, I say this, meeting after meeting, is this concern, which is, this is advisory to the county, it's staffed by the county. So where does this city, other than being a required placeholder, where do we really fit? And I can't tell whether either of these two structures actually defines that or changes that in a different way. But I think the city, as you all know, is stepping up to do more and more and more around homelessness and we can just record that as a separate thing, but if we're looking at all of Lane County and what our needs are and how we're meeting that, it doesn't make sense to be separating out the city of Eugene as if it's completely independent and on its own. So I don't know how to evaluate these two options with that challenge, which would be better. I mean, the city of Eugene is contributing towards the HSC. So that feels like a really critical role. But if we're seeing the PHB has this action role, then I don't want to be left out of that. It's just like, I can't tell. So I don't know, as you're going through this process, how does it play out? How would it look different or feel different from the other jurisdictions' perspective?
And Chair, quick wonder if I may respond to that ever so briefly. 10 years of my service on the HSC, I was a Eugene City Councilor. So, I knew the relationship that I had. And for a long time, the city of Eugene contributed more highly to HSC historically than it does today. In those years, I viewed it as my responsibility to report on the matters of the HSC back to the Eugene City Council. And to be frank, the Eugene City Council quite often, I wouldn't say washed its hands of it, but said, we trust the HSC to be doing the work that we charge it to do. Now, since then, Mayor Vinnis, the city of Eugene has really reached out and grabbed some really powerful programs that it brings in that wouldn't have come in other than the tremendous engine that the city of Eugene provides, and we all acquiesce to that. And I think the challenge for us is to make certain that the work of the HSC and PHB in conjunction is knitted with the city of Eugene and the city of Springfield and the city of Cottage Grove and Florence, but Eugene's the driver, Eugene's the engine. It really is. Nobody can deny that.
I'm sorry, this is turning into a discussion, but if that's okay with you, Chair, I think, what's interesting is we've just gone through the creation of the MACs and that decision-making process, and that feels to me like an interesting model. So I guess I would say, what are the lessons learned of having the agencies come together to look at that pot of money collectively and the options, and how does that influence how we see these two agencies? Because I think it's true that on the one hand, the city of Eugene is an engine because we've invested in pilot projects. On the other hand, our hands are tied because we're not a continuum of care. The funds that came from the state came to the county. They didn't come directly to the city, so there was a collaborative process on the MAC, but that continues to be a challenge for us, is that we're taking on this challenge, but we're not authorized, we're not funded that way to continue. So this relationship is pretty critical to us, and I don't want us to be sort of left out as that the work we do is wholly separate from how these two bodies function. So our commitment to HSC declines because our independent commitment to this work has increased astronomically, right?
Perhaps, Mayor Vinnis, without continuing the discussion here, you and I can step away
Yes,
from the table sometime and talk more in detail.
Absolutely.
Thanks. I see Chris, Councilor, has his hand up.
Yes, this is a rough and tough topic, especially for someone from Springfield. I do know that our mayor's representative and our city manager just left when we started talking about accountability and next steps for the overall general group. And Springfield is a member of the HSC, but has not participated in the TAC report, did not participate in a lot of the next step. And with the MAC group, Springfield's unrepresented in some of the allocations. And again, the absence is very, very scary for those who do services in those areas. So whatever we do to move forward, if it's the county's onus, then they need to make sure that every district is represented. And if it's the multiple jurisdictions onus, then we need to make sure that every jurisdiction is represented. Otherwise, we will continue to be burying people at a faster rate than we're housing them. Thank you.
Yeah, Jacob?
Yeah, I would just flag that for me, the like the Human Services Commission, the PHB, the MAC, and let's not forget the City of Eugene's Housing Policy Board. that does have, some connection to the work of addressing homelessness in the community. For me, that's just a lot. It's super inefficient to have that many committees. So I'm a big fan of trying to combine, streamline, and have action-oriented committees. And for me, part of action orientation is that committee members get to deliberate and provide input into decision making. And, again, I just flag, I'm extremely appreciative, and I have tons of respect for, the staff that serve all these committees, but it is a lot of presenting and not a lot of engagement and discussion. So.
Thanks, Jacob. Chris, do you have your hand back up, or is that leftover?
No, ma'am, it's left over, sorry.
Okay. Anybody in the room there, Kate or Pat?
No.
Actually,
Oh,
I'm sorry.
Councilor Fleck.
I'm going to jump in. This is a tough one for me. I've been in office for, one capacity or another for about 20 years. And so typically the way these work is you have committees that then, give advice to the elected officials that make the ultimate decisions. And so I'm kind of stuck in that framework. And in this role, I would hate to lose partners because of perceptions. And so, and I remember back before PHB was I think it was the CAC, wasn't it? The Citizens Advisory Committee, which was just an advisory group to the HSC. Then, of course, the PHB needed to get bigger to meet all the continuum of care requirements. And so I guess I'm not sure. I know when I was doing the survey, I didn't really have a strong feel other than I did not want to step on the toes of any of our partners, whether that's Lane County, Springfield, or Eugene, because they are the big players in this game. That being said, a lot has changed in the realm after Martin Boise and House Bill 3115, that now each city now has an obligation. And I don't know that in that morphing, whether small cities, this came up at the HSC meeting, should small cities, be involved more with the HSC? I certainly would love to have our smaller jurisdictions represented, but we also, the conversation comes around, do we have the resources, to be a significant contributor? And I have to say, I don't believe that we do. So I'm not sure what the answers are. I just thought I'd offer that feedback to this group as well. Thank you.
Well, a very quick response to that, Councillor, and when I was with the City of Eugene, I believe this, that the county is responsible for the smaller jurisdictions, that there is a responsibility there for however the county applies its attendance, that it really is, if whoever's there for the county is not listening to the rural communities, the smaller communities, then we're missing the mark there. And that's where the county's feet should be held to the fire on that.
Yeah, Debbie?
Yeah, and I apologize. I did have to step away for a moment, but I'm a little bit confused. So when we're talking about strategic committees have been disbanded, are you talking about the HSC, Chris? Because we have strategic committees on the Poverty and Homelessness Board.
The Strategic Planning Committee itself, which was responsible for renewing the 5-year plan, was disbanded in 2019 because Mr. Manala said that we were changing focuses and it didn't have its need anymore.
Okay. So I guess my question would be, because I've listened closely to what everyone said, and as a representative from one of the CCOs, we have members of our health plan, which received the Oregon Health Plan throughout Lane County. And I really appreciate all the work Eugene has done, and certainly that's the hub of all the services. But we continue to focus on rural communities and the lack of services there. And we need somebody that's advocating for them continuously. We need a forum where we can talk about, the great things that are being done in Eugene and Springfield, but what about Cottage Grove? What about Florence, Oak Ridge, Mackenzie Bridge. Those are areas that are of a focus and a special importance to us because the rural communities tend to be underserved, and they have populations of underserved living within those communities that don't have access to the services that Eugene provides. So I think I did do an interview with Uncommon Solutions about my thoughts around HSC and PHB. I didn't see any reason why the two couldn't be combined and why the work can't be done together. If there's too much reporting at the PHB, then that to me just sounds like a format change of this group, and that's something that we could do together. We can build that with the help of the chairs. I mean, we're having great conversation and discussion today, so I think maybe this is an example of how when we have an issue that we all need to weigh in on, that there's lots of opportunity for us to share our thoughts. So back to you, Brittany.
Thanks, Debbie. Is there any other comments in the room? And Kate, I don't know if you want to wrap up or talk about how we're going to get to next steps here.
Sure, and thank you. Really appreciate the feedback that's been shared today. There isn't an easy path, and so this process has been really illuminating. And I think particularly for myself and Kachina, who are newer to this work, let alone all the other folks who have weighed in. So thank you for your time and energy around this. The next step is for the chairs at the end of August to get together and kind of identify what the path is. And so if you have additional feedback or want to have more in-depth discussion, feel free to reach out to myself or Kachina, and we're happy to do that. So thank you. Appreciate this space to chat further.
So it looks like Navigation Center is up next. And I just want to do a time check. We got about 20 minutes left and have about 40 minutes worth of content. So if we can do our best to trim everything we got on here.
I think with the Navigation Center, let's look for about 15, and then 5 for Brianna, and everything else we can table.
Okay.
Absolutely. Good afternoon. Can everybody hear me? Okay, perfect. So my name is Maria Cortez. I'm a program service coordinator for Lane County Human Services Division. And I am joined today by Keely Crossan from Equitable Social Solutions, as well as Haley Finnegan from Equitable Social Solutions. I'm going to give you all a brief overview of some of the outcomes for the Navigation Center for this past 10 months. And then I will pass it over to Keely and Haley to talk a little bit more in depth about the program itself and what that looks like. So opening date for the Navigation Center was September 12th, 2022. And the data I'm going to share with you today is from that first fiscal year, so up through June 30th, 2023. And over that time period, there were 194 unduplicated individuals served. Of that number, 131 exited, and 63 remain sheltered as of that June 30th date. So it's safe to say that the majority of residents identify as white male having a disability and receiving no income, and I'll go into that a little bit further. Next slide, please. So as you can see, when looking at demographic data for gender identity, we have about 111 of the folks served were male or identified as male, 76 as female, 2 as transgender, and 5 as identifying with another gender. For race and ethnicity, 150 of the participants have identified as white, followed by 20 as American Indian or Alaska Native. So looking at age, majority of folks served by the Navigation Center are falling between that category of 25 to 55. But it is notable that a significant portion of individuals were over the age of 55, so senior citizens. For income, we're looking at 126 individuals having no income, and there are about a quarter of folks served who do have an income of below, at or below $1,000. A quarter of individuals served identified as having a disability. And I want to share SPDAT score, and so there may be folks listening who aren't familiar with what a SPDAT score is. And so this is essentially a level of vulnerability based on an assessment given to each individual, and they're determining whether or not they might have a mental health condition, another disabling condition, medical issue, physical disability, substance use, background, so on and so forth. It also indicates the length of time homeless. And so the scores here between 8 and 12 would be considered pretty high, and 13 and over would be considered very high. And so this gives you an indication of the level of vulnerability and challenges that these individuals are experiencing, and that the Navigation Center staff are serving. And then when looking at exits, of the 29% that we have listed here, 27% of those went to a permanent housing option, and another 2% went into like a long-term care facility. When looking at what we have listed as negative exits, we're looking at folks who may have gone back out to a place not meant for human habitation, or may have gone to another shelter option in the community. The other 11% of those we have listed as negative exit would be the hospital or jail. And I will go ahead and pass it over to Haley. And Haley, do you want to?
All right, everybody, thank you, Maria. Like she said, my name is Keely Croson, and I am the Deputy Project Director for both Brooklyn Street Emergency Shelter and the Navigation Emergency Shelter. So we'll go ahead and get started. Next slide, please. Really quick, gonna just do a brief overview of our project mission, just for anybody who has not been introduced to us yet, so we can kind of illustrate what our next slides will be about.
My name's Haley. I am a program manager for the River Avenue Navigation Center and for the Brooklyn Shankle Street. Just a quick reminder of our program mission. So Equitable Solutions Navigation Center provides support for adults who need assistance transitioning from houselessness into safe and stable housing. The Navigation Center provides emergency shelter for up to 75 adults. Our focus is to support individuals in reducing housing barriers and working together with participants to obtain long-term stable housing. So while we do form our program around that 90-day model, we can extend that time for as long as it takes for our residents to get into housing, as long as they're behaviorally appropriate and engaging in case management services. We don't want time restrictions to be a factor that perpetuates homelessness.
Thank you. Next slide, please. So the Navigation Center upholds a low barrier access model, and the data that Maria just presented really illustrates the type of population that we are aiming to serve at all times. So it's a population that is typically turned away from other resources because they don't have the ability to self-regulate to continue access to care. And at the Navigation Center, we empathize with the fact that sobriety, recovery, and access to even emergency healthcare services is not necessarily achievable if your basic needs are not being met. So our program creates individualized support plans that target the diverse needs of our participants. In doing so, we foster that person-centered environment that focuses on housing while addressing the immediate supports along the way. We aim to meet our residents where they are at in the journey to long-term stabilization. Our goal is to provide safety, shelter, and inclusivity to those who require comprehensive and immediate supports for long-term housing to be achievable.
Next slide, please. Right. So a unique thing that we get to practice at our program is Housing First. So Housing First removes the boundaries that are often associated with housing readiness. We believe that securing housing is the most important factor for stability. So the benefits to a low barrier Housing First approach is limited preconditions upon entry, such as sobriety, treatment, or service participation requirements. Upholding strict entry requirements limit access for vulnerable communities. We understand that a vast intersectional barriers this community is facing, and it would be basically impossible to expect them to accomplish or overcome these barriers upon entry to program or stable housing. Recovery is not a requirement to gain access to a basic human right such as housing. So our Housing First program allows for a foundation and a platform to pursue goals and improve the quality of life. On-site services such as peer supports are offered to maximize housing stability and prevent returns to homelessness, as opposed to addressing all predetermined treatment goals prior to housing entry. The Navigation Center meets those basic life necessities while also teaching life skills and independence to be out on their own. So really quickly, some of the amenities that we have on our site is that we have a laundry room, so residents can do their own laundry. We have a crisis room for any mental health needs. We serve 3 meals a day, so breakfast, lunch, and dinner, and we also accommodate any special dietary restrictions. And then lastly, our residents are going to have access to case management, peer support, and financial supports, which are going to accelerate their path to housing.
Next slide, please. So we'd like to present some of our very exciting updates that we've accommodated over the past year. So we've introduced culturally responsive peer support services to our program. This is a huge accomplishment for us because it allows us to hit those target needs of the individual without necessarily crossing over that barrier that case management would have if they were trying to provide peer support. So these peer support workers get to attend community meetings with their individual, whether it's doctor's appointments, emergency crisis services, or just close that gap where we see a lot of case management start to taper off because that individual isn't able to self-regulate through those meetings, or a crisis comes up, or just basic, underhoused situations kind of get in the way of overall comprehensive case management. Additionally, we've added internal transport services to ensure a culturally responsive outcome. So what that means for us is we've added 2 fleet vans for the Navigation Center. So 24 hours a day, we get to take our individuals to the community to get their Social Security done, to apply for jobs, to go see their kiddos if they have court-ordered visits and things like that, while having a staff member there to help them regulate and just close that gap of services. This also helps us kind of cut down on the emergency response calls. So if it's a CAHOOTS call, a right source call, or an emergency service like 911, we can transport our residents to the hospital or to the police station or any other type of emergency service. So that's really helping our community and keeping that call log down so that we're not overutilizing that service too much with our population. Additionally, we created a partnership with the intern department at the University of Oregon. We're really excited about this because we get to provide that firsthand service for students who are really passionate about human services. I think a lot of classroom work can kind of fall short when you're talking about human beings. They don't really follow a structure. So we get to allow them the exposure to real people and real issues that we're dealing with in time. This also allows us to create jobs for kids who are coming out of college and individuals who have just finished their program so that they can go directly into their service. We've had ongoing continued education from both Equitable Social Solutions in Lane County, so whether that's just domestic violence awareness, the training that goes along with that, or just something really basic like CPR and first aid for individuals who are in a crisis like Narcan and things like that. We've continued that education. We're very quickly learning that we are always learning more about mental health and behavioral health, and the best way that we can keep up on a equitable policy and practice is if we're continuing mandatory education for all staff members and site members. This is not a new accommodation, but we are just continuing to serve 3 hot and cold meals a day. Our population can sometimes suffer from a wide array of dietary restrictions and needs. And upon intake, we continue a document for each individual that follows their dietary restrictions and needs. So at 24 hours a day, they can access the food and care that they need. And it also is tailored towards any sort of aftercare hospital plans that they may come into after inducting into the navigation center. And this is also really helpful for individuals who would like to practice cultural or religious food restrictions or dietary needs and haven't been able to in other shelters or on the streets, because sometimes there's a limited supply of food and you kind of have to take what you can get. We are able to purchase on our own the foods that the individual is asking for rather than making them stick to a strict menu, to kind of help incorporate healthier habits so that they have more autonomy over that. And we've partnered with a 24/7 internal and external security firm. What that looks like for the navigation center is we have security on site that does hourly to 15-minute rounds depending on the need. So they're just securing the perimeter for staff, for the individuals, and for the neighboring businesses. They don't physically intervene or provide any sort of physical intervention. If there is a crisis, that's what our staff is trained to do. And they do not carry any weapons or any sort of punitive instruments on them, but they do observe and report, and this has helped kind of mitigate the loitering issue that the neighboring and partnering businesses have seen on River Road and just in Santa Clara area, which we're really happy about because I know that was a huge concern from the community as we were coming into the communities, that we were bringing kind of a bunch of guests to loiter the area. But since having that center, a lot of our guests do not feel the need to loiter outside because they have everything that they need inside. So we're just maintaining the perimeter. Next slide, please.
All right, I'm going to go over some community engagement. So recently, we took our residents out along River Road and the surrounding areas to clean up trash and debris. We really appreciate all the support that we got from our neighbors upon our startup in this last year, so we wanted to give back a little bit and encourage some healthy community involvement with our clients. Next up, we hosted a Rentwell course that was instructed by Laurel Hill. So Rentwell is an 8-week course in which residents are taught different topics such as conflict resolution, fair housing laws, and positive lease agreements. So that was really beneficial to our residents because they got that experience, and at the end of the course, when they graduate, they get a certificate and then access to the landlord incentive funds. We have a partnership with Home Health. So Peace Health comes out very regularly to do skilled nursing and long-term care for our residents. This has been super supportive, so our clients are not obligated to travel off-site, often multiple times a week to receive services, and Peace Health can come out to us and provide those services on-site. We facilitate regular meetings with community partners such as FIT and the FUSE teams. And we also have some volunteer work from a previously graduated resident being done. So one of our residents who successfully exited into his own apartment has been dedicating his time to come out, and he's painting a large mural on the wall. So he's doing a big tree, and the branches and the leaves off the tree represent other residents who have successfully exited the program. So we're really excited about that, and we appreciate his dedication. It's just going to create a more inviting environment for all of our residents and boost morale for clients as well. Lastly, we have an open door practice for community partners and emergency referrals. So we support any emergency referrals for folks who are experiencing crises. If we have the staff available, we will accommodate those referrals at any time, whether it's in the morning or at night or over the weekends. We want to make sure that we're supporting our community partners who need those immediate emergency shelter referrals.
That's it for us.
Okay, thank you. So we have pretty limited time, and it sounds like we do have one more agenda item that needs to be touched on. Kate, sounds like staff can take the questions that are in the queue here, or in the chat at least, maybe do a Q&A to send back out to folks.
Yes, exactly. And I will say, just regarding the wait list, that entry is through coordinated entry. And so when a space opens up, ESS shares that with coordinated entry, and then coordinated entry refers based on those who are waiting from the top of the wait list down. And so that's how any open space gets filled.
Okay. So I would go ahead and say if folks have questions or want some more clarity, and you're on Zoom at least, you can put those in the chat. We'll make sure that staff get those questions. If you're in the room, hopefully you can touch base with Kate afterwards and she can add those to the list. Okay, so sorry we didn't have time to jump into those right now. Kate, looks like we have one more presentation that needs to happen today on the needs assessment.
Thank you. I will try and be brief here again. Hello again. So we will bring up the quick presentation. It is just an update on the community needs assessment. First is the timeline for the community needs assessment. I'll start talking while that gets up. I already see a correction here. So the community needs assessment is done every 3 years, and it's a requirement through the community action as Lane County as the community action agency, and it starts with a survey of taking a survey of the community, all folks in the community, to identify needs and gaps in services. And then from that, an assessment is created. And from that, we build our strategic plan to see, or to create action items towards addressing those needs and barriers. So as far as a timeline on it, we have completed the first draft and are working on a revision right now. The quick correction is that the second draft will be completed on July 28th, not July 21st. Give myself one more week instead of one more day. And just a quick thank you to the housing team and the ad hoc committee for providing edits and input on the first draft. After the second draft and a couple revisions, we'll present it to the PHB, and then after PHB approval, go to the Board of County Commissioners for approval, and hoping to do that by October 1st. That is the overall goal with this one. And then I wanted to share just a quick data piece so far. I'm calling this the cool graph because it is so cool. I hope to have a better name, but I also don't want to change it. So this graph will show the top 3 needs that were identified in the survey in each of the 8 areas. And so on the far left, column 1 is the top 3 needs in each area. Column 2 is, yes, page 44. Column 2 is the percentage of people or respondents who chose that need. And then columns 3 through 15 show a chi-squared statistical, it's a hard one, test among each of those demographics. And a plus or minus indicates when people who are in that identified demographic selected that particular need more or less than the folks not in that group. So, no. Keep going.
You had it earlier than that in the packet.
It says 44 on the packet.
You had it and you went past it.
No. What was after that?
For the
There. That one.
there it is.
Yep. It's very small. So small. So on the left, again, top priority needs, and then total respondents, and then the plus or minuses are saying which areas those folks are seeing those needs higher or lower compared to the population. So for unstably housed, those who are unstably housed chose affordable housing and moving costs more often than those who were not unstably housed.
Oh.
It's a little way to look at it. I know it's a lot of information to look at right now. Overall, the response is aligned with the needs and the feedback that we hear from the community on a day-to-day basis. And the majority of barriers that respondents chose were that they needed more support around case management and knowing and understanding where to go for services. And the full assessment will go into much more detail on this and many other graphs and results from the survey as well. We're excited to get that out in the next couple months. I know it's very small. Yes. Any questions? I know we're short on time and over time.
Did this tell you anything you didn't know? I mean, did it reveal anything new or surprising?
Yes, I knew that we all hear that, you know, folks in case management, there are services that can be confusing with how to access services and when you qualify for something and when you don't. I did not expect that in, I want to say almost all of the 8 service areas, the top barrier was case management and understanding where to go for services. I did not expect to see that in every single one, either all 8 or maybe it was 7 of the 8. I expected it in, you know, a few of them. I did not expect it in all. I think that was the most surprising.
That is interesting. That is interesting. When you think way back to the TAC report, one of the issues that the TAC report was attempting to solve was that people fall through the system. And it was that lack of a warm handshake from one thing to the next, right? Suddenly they don't qualify and they can't get to the next. So that's been the long-standing gap, and it's still there. Interesting. Okay. And discouraging.
Other questions? Okay.
I can't quite hear if there's some discussion still happening in the room. If there's any other comments there, Brianna?
No additional discussion.
Okay, great. All right, so Kate, assuming the rest of these things are good to move to the next meeting?
Yes, can move to the next meeting, and we can also add an agenda item at the next meeting related to the Navigation Center as well.
Okay, excellent. That was my next question. Okay, so our next meeting, want to make sure that everybody sees the August meeting is canceled, so we won't have a meeting then. And then our next meeting will be another all-member meeting on September 14th, which is a little bit off of our normal schedule, but we want to meet then in order to finalize the continuum of care application for the timing of that, if I'm right. If that's right, Kate.
Correct.
Excellent. And the 21st of September, we will still have an executive committee meeting as well. So I'll double up in September, but cancel in August. Okay, if there's no other immediate business, then we'll go ahead and adjourn. Thanks for hanging out a few extra minutes.
Thank you.
Thank you.